Thank you. Members, and welcome to everybody. Before we start, I would like to welcome Councillor George Crozier, as this is your first meeting on this committee, so welcome. I would also like to report that Martin Cheeseman is no longer the Medway Health Watch representative on this committee. The new representative is Emma Sue Willows. Yes, so welcome.
Thank you.
Pleasure. That takes us on to apologies for absence. On our side, we have Councillor Roger Barrett and Councillor Richard Thorne. They both have problems. Councillor Murray.
Just Councillor Prentice being committed.
Right.
Family commitment we've got to deal with.
Thank you. Can I sign the record of the meeting held on the 12th of January as correct record? Yep. Thank you. I have no urgent matters. Are there any disclosable pecuniary interest or other significant interest of whipping? And can I just say, Councillor Ahmed did ask if she was all right for the agenda item 5, but she is because she signed the petition, but that's only part of the report, so that's fine. Which takes us on to the members' item, Rainham Healthy Living Centre. So I'd like to welcome Councillor Potter and ask you to introduce your report.
Yeah, thank you, Chair. Well, the report is as read. You can see clearly in 2.4 what the concerns are, and this is a timely follow-up to the petition and members item that came to this committee in 2021, and actually you'll see we're essentially expanding on that with this members item tonight. So just to remind members of the context and the history here, so there were 4 GP surgeries based at the Rainham Healthy Living Centre. Showed the green suite, blue suite, the yellow suite, the red suite. In 2018, the green suite, which was a satellite branch of the Woodlands Road practice, moved out of the Healthy Living Centre and consolidated on the Woodlands Road site. At that time, we raised concerns. We met with the NHS, and we were told that the existing surgeries that were still in the Healthy Living Centre were going to be collaborating and working together for the benefit of patients in Rainham, and that there was an active recruitment drive going on, and that was around the time the Kent and Medway Medical School was coming on stream. So that all sounded very positive. We fast forward to 2020, and the blue suite was closed by the Long Catless Road surgery. So the blue suite is again a satellite surgery of Long Catless Road. That was closed due to the pandemic. That was the reasons given. Although that wasn't an official formal closure, that was just an operational closure. The reason we put forward a petition at that time was because we were concerned of what with the trend that we were seeing with reduction of GP services located at the Rainham Healthy Living Centre. Not necessarily that we opposed what Long Catless Road surgery were doing. Again, they were putting forward an argument that they wanted to consolidate on their site up in Parkwood, but our concerns were broader around that provision of GP services at the Rainham Health Living Centre, and also ensuring no reduction in service at that surgery, even if it's all based at Parkwood. So following the members' item we brought to this committee, we were given assurances around the future of GP surgeries in Rainham, that we would be notified of any changes, and we did have an opportunity to meet with the NHS following that members' item. We were again given assurances around the provision in Rainham, but we fast forward to today. We now see that the Long Catless Road surgery want to formalise the closure of the blue suite, And fair enough, it's been de facto closed for 3 years. But at the same time, with the yellow suite, we've now seen that since the takeover by Maritime Health, that there's no GPs that are solely based at the Rainham Health Living Centre. So we used to have 2 GPs based at the yellow suite. Both of those have now gone. They just have a bank of GPs, and they operate essentially a hub model from St Mary's Island and from their larger surgeries. So we only have one surgery that's solely based at the Rainham Health Living Centre now. So that is why this item has come back to you today. There's also a wider concern there about the utilisation of the Rainham Health Living Centre, a purpose-built health facility, built at great expense to a standard to meet the regulations, to be a building that is fit to house health provision. And I think there's also a wider concern across Medway around what is the plan, what is the strategy with healthy living centres, and how we're dealing with inequalities of access to healthcare. I know there's a lot going on around the provision of a potential healthy living centre in the Chatham area as well. So I think I wanted to broaden it out in that sense. I'm also aware that there is over £100,000 of S106 that's currently sitting with the council that the ICB could draw down for the Rainham Healthy Living Centre, which they haven't touched, and there's a potentially £500,000 in the pipeline to be drawn down for the Rainham Healthy Living Centre. And again, there doesn't seem to be a coherent plan here, and that may well be happening with regard to other health facilities across Medway. So, members, my ask of you tonight is that, as a committee, we ask the NHS for a review of primary care provision at the Rainham Healthy Living Centre, so we can get the full picture as to what is going on there and what the plan is going forwards, with the idea of making sure we do have that timely local access to GP services in Rainham. And I should just make a further point there that, of course, we are seeing more people moving into the Rainham area as some new housing estates are being built, and actually the Healthy Living Centre should be where their surgery is located. But I think at the moment they're struggling to get onto the list for a surgery in the Healthy Living Centre, likely because of the reasons I've stated. I'd also like an update on the primary care strategy on the whole in Rainham. So as well as specifically for the Healthy Living Centre, what's the strategy on the whole for the Rainham area? And also with regard to Healthy Living Centres across Medway and this underutilisation that I'm highlighting with the Rainham example, and the S106 that is already there or in the pipeline that isn't being used at the moment and could also be an issue elsewhere. There's S106 for other healthy living centres or other surgeries. What is going on with that? So if we could also have an update on what is going on with the healthy living centres, and is there a strategy there, and is there a plan to draw down on funds that are available? And there is also the potential, depending on the decision the committee makes tonight, to include this work with regard to your access to GP services task group that you've had going on for a number of months. Okay, thank you, members.
Thank you. If that was a very long recommendation, so if I could ask that it's tidied up with Michael, with your meaning, but without being a page and a half.
Yeah, I mean, thanks, Councillor Potter. I think the experiences of your constituents mirror the experiences of lots of constituents across Medway, and the essential issue is communication, isn't it? You've had different stories about what's happening over quite an extended period of time, and the issue of underutilisation has been discussed here before. And in the transition period from the CCG to the ICP, I asked whether there was a premises strategy, and there wasn't a premises strategy. And I think the lack of one still persists, actually, in spite of all the work that was done on the GP task group by the ICP themselves, led by Sukh Singh, and by the Health and Wellbeing Board. So I'd like to think that things will improve in the future. What you're asking today seems a bit different to what you were asking in the petition, but I suppose that's because time has moved on. And having an overall update about the healthy living centres, because of course there's a big development with the one in Rochester, where the new diagnostic centre is going to be sited, although our engagement with that has stalled because the ICP rep who was going to come along to the visit that we were all going to attend wasn't able to come. So I think there's a lot going on, and I think there's certainly in the GP task group we saw huge willingness in the primary health community to make improvements and come forward with innovations and change. But their ability to do that is related to all kinds of things: demand, capacity, changing populations. So appreciate, hearing in detail your perspective as a member, but I think I'd like a little bit more clarification on what exactly is being asked. I know you've just asked Michael to sort of tidy it up, but what's being asked is different to the petition, so we just need to be clear. But, as a general point, keeping patients informed about what's happening, making sure that they feel confident that the services in their community are the ones that they expect is important, and I don't think there's anyone around the table who would disagree with that, actually.
I'm happy to respond if that helps. So what's in 2.4 is different from the petition. So the members' item tonight is not the petition that was in 2021. So this is building on that. And of course, things have moved on and it has broadened out. So essentially, the asks that I've stated here are what is detailed in 2.4. So it is that review of primary care provision at the Healthy Living Centre, and that general update of the primary care strategy as it relates to Rainham, and then that wider issue of the utilisation of the Healthy Living Centres, the drawdown of funds for Healthy Living Centres and surgery premises.
Okay, we're happy that that was a clear summary.
Yeah.
I would also like to have noted that the ICB have been asked to attend tonight, and obviously they're not here, so they can't respond. We can all look at our papers, page 21, C6.1. We did expect the Integrated Care Board to be here to provide a response, but obviously that can't happen. I would also like to refer to 2.2 on page 19, the second bullet point, where the CCG did say that they would keep us updated on any new proposals. I would like to ask that the ICB honour the previous commitment from the CCG.
Chair,
Councillor Lammas.
Did the board give a reason for their non-attendance?
Not that I'm aware.
I did ask if it was possible for someone from the ICB to attend, and the response was it was just unfortunately they weren't able to field anyone tonight.
How much notice was it after?
This would have been probably 2 or 3 weeks ago.
Thank you. Are members happy with those comments and the recommendation?
Can I just ask, the review and the update, will they come to this committee or will it be dealt with offline? That's what
Couldn't get that to work. No, what you've asked for, if the committee agree that, it would come back to this committee for consideration.
Mr. Chairman?
Sorry,
Have
Councillor Crozier.
Sorry, could I ask if you've summarised the recommendations?
Yeah.
We're just about to.
Yes,
Sorry.
that's fine. So Michael will summarise.
So just to be clear, what Councillor Potter is asking the committee to decide is to ask for a further report on a review of primary care provision in Rainham and the primary care strategy in Rainham, and also a wider report on the use of healthy living centres across Medway, and also the funding issues related to that. Is that a fair summary, Councillor Potter?
Yeah, but specific, the initial review I asked for was specific to the Rainham Healthy Living Centre. So reviewing the provision at the Rainham Healthy Living Centre as part of an update on that wider strategy, or primary care strategy for the Rainham area.
Right. Are members happy with that? Thank you. Councillor Purdy, is that the recommendation and comments as just discussed?
Well, I had actually written it down.
Oh, over to you.
Though I did find it difficult, as you obviously realise, Councillor Wildey, to get my head round it. I should put this forward and members will ask for a further... Gosh, now I've lost it. I was out to further care strategy in Medway, wider issues within Medway. Is that correct?
Right, Michael, could you summarise again?
Yes.
Well,
So
go with that.
So it's a paper on a review of primary care provision in Rainham Healthy Living Centre as part of a look at the wider primary care strategy in Rainham, and a report on healthy living centres across Medway and their funding.
Well, as Michael's put that so nicely, I'm sure members will agree with that.
Thank you. My comments? Yeah, okay. Thank you. Is that seconded? Yeah, thank you. Councillor Turpin? Thank you. So we will move on to agenda item 6, Medway Community... Sorry, thank you, Councillor Potter. Yes, I'm being remiss, forgive me.
It just took us such a long time to get our head round all of it.
Yeah, thank you. So again, moving on to agenda item 6, Medway Community Healthcare Service briefing from Penny Smith. So hello and welcome.
Thank you. Firstly, I'll assume that it's been read as previous reports. I would also like to apologise because, thank you, because I understand the graphs are very hard to read, the font size, etc. Unfortunately, the tool that we use to extrapolate the information, you can't manipulate it, so I've taken it back to the team for future reports to say, can we make it clearer and a bit more concise so it's easier to read? So apologies for the graphs. I suppose the kind of bits that I would want to highlight in particular are our Chatham mandatory information and training has significantly improved since the peak of COVID, and there's been real focus in particular on infection control, safeguarding, etc., where we are focusing on individual services areas where the compliance wasn't where we would want it to be. The other aspects which I omitted from the report, but probably would be an obvious one for questions, around vacancies. So we still hold, at this moment in time, clearly it changes on a day-by-day basis, just over 150 vacancies within the organisation. And that ranges from non-patient facing, so administration, reception, housekeeping, to patient facing, so clinical staff. They cover a wide area. I suppose the key areas are ones that I've reported on previously at these meetings. Community nursing still remains an area of concern where we've got a high vacancy factor, and it's very hard to cover that with agency or 0-hour staff. We have a small vacancy, 5 at the moment within public health nursing, but we have been successful with recruiting agency and 0 hours for those particular areas. And we are finding now that we're having quite a struggle with recruiting to occupational therapists. So there's a detailed piece of work that's happening across the organisation to particularly focus on those areas to see what we can do, because the general advertising and the general recruitment drives don't seem to be working. So we are targeting the profession and the individual professional magazines, etc., to hopefully try to entice that client group to come forward. It doesn't seem to be an MCH anomaly. It seems to be a wider national issue around OT. And then I think finally, the area that I'd highlight, we are looking at our recruitment drives and how we are trying to entice people over, and rather than just doing the old-fashioned traditional route of advertising, we are hosting recruitment days. We had 2 last year, and we've been successful on both, and I've highlighted as a snapshot under section 3 of our recruitment day a couple of months ago, where we managed to secure a number of, in particular, community nurse and neighbourhood nursing staff. So that was a real key driver for us. So we're going to continue to do those going forward, because I think the personal touch and being able to actually sit, meet the team, actually have clinicians at the forefront on the day so they can actually talk around workload pressures, what it's like to actually be within the services, certainly was proved more successful. And when you look at the statistics from our recruitment on paper or web to the face-to-face approach, it's been a real positive experience for us. I was asked to include some information around safeguarding, which I've done. I'm not an expert in that particular area, and unfortunately the safeguarding lead couldn't attend with me because of personal commitments tonight. So if there's any questions that I might have to take them back. And then finally, I just included quick headlines on health and wellbeing strategies around what we're doing to support our teams, making sure they're as stress-free as possible and that we're looking after their mental health. I'll take any questions.
Thank you, members. Councillor Murray.
Thank you, and thank you for the report, Penny. I wanted to focus on the wellbeing of staff, because obviously you have had a lot of sickness and you do seem to be suffering high turnover. I think it's really positive that you've been doing recruitment days, and on that, are you getting involved with any of the education organisations, the university and the college, who can encourage people to come into these areas? I had a really interesting visit to the Life Sciences faculty of Christchurch last week, and saw the simulators that they've got there, the ward setups, the clinic setups, as I'm sure you probably know, they've got a flat there that is a home setting for delivering care into. So there doesn't seem to be any shortage of enthusiasm or shortage of recruitment. The gap seems to come when we want people to move from education into one of these professions, and I'm sure there isn't a magic bullet, but I'd like to hear your perspective on it. The other thing that I would say from direct experience with my mum, who often sees the adult nursing team, and through casework, that there does seem to me to be fairly significant communication problems still between care navigators, doctors' surgeries, and the teams themselves. So I'm not always convinced that making the most of every encounter sort of, agreement that everybody's got is actually being maximised. Sometimes if someone's coming to do a routine thing, like, look at leg dressings or, inspect diabetic problems, to carry out a blood test, give a regular medication. There's a whole lot of other things that could usefully be done on that visit. My direct experience is often that I'll be told, or my mum's carer will be told, and I've heard this from constituents lots of times, oh no one's told us to do it, so we're not going to do it. And I just think, it would make the whole system more efficient and save the admin support teams that work with you a lot of trouble if there could just be a more holistic kind of approach through the care navigators, and maybe that would take some of the stress out of the things that the workforce are carrying out.
Okay, in relation to the first questions around kind of education links, etc., we do have 2 dedicated individuals within our quality team who make strong connections with the universities and colleges. We have recently, over the last 8 months, been working with the local college and actually having them shadow our intermediate care services. So we're getting them from a much younger age, as opposed to waiting for the 18 and above. We're actually been targeting 16 and above, and that seems to have been quite a lot of enthusiasm. It was small numbers because it was a bit of a pilot to see how it would go, and I think out of the 10 students that we worked with, I think 4 dropped out because it wasn't for them, and that's going to happen, but 6 showed a real commitment to continuing that dialogue going forward. So we're learning from that to see how we can adapt it to other services. So the answer is yes, it's small steps. I think we can do more, and then that's what we're starting to address. I wholeheartedly agree with you about communication handovers, and it would be foolish to say that there's no problems, because there are. I think even internally, we probably have handoffs between our own services. So when you start looking at community, primary, secondary, voluntary sector, that it makes it a much more complex situation. What we do is we do meet regularly with the LMC and primary care to say, are they having any challenges with us? Are we having any challenges with them? And then we look to say how we can actually improve those areas. And I think what we're also doing internally, we've just started quite a big project around actually, rather than looking outside of MCH, look inside to say, do we have those conversations? So do we have 2 or 3 clinicians might go to the same patient on the same day? Because actually, can we work differently? Can we work smarter? And it's much better for the patient to have a continuity of care with the right individual, skilled individual, but they don't want necessarily 3 visits. They'd much rather have 1 and it be undertaken in a much more holistic fashion. So I think we've done wonders in some areas of our services. In other areas, I think we could work smarter, and that's the path that we've just started on.
Thank you. Councillor MacDonald.
Thank you, Chair, and thank you, Penny. Can I start off, Penny, by saying about the report? I think you can never win with a report. I know you can't. It's either people want loads of stats or they don't want too much detail. I found it, I mean, it was very honest and it was quite depressing to read a lot of it, actually. I will touch on the sickness part in a moment. But also, I do know that you do a lot of good stuff. And, you know, in the short report, I suppose we don't get a flavour of that. So it's only something to take away. You can never win on any committee, so don't worry. But it would have been good to see some extra bits. The staff turnover is a worry. I know there is a turnover in a lot of fields at the moment, but I suppose following on from Councillor Murray's question, it was around what you're doing actually, because it says it's on a trajectory, you're trying to do something about it. It'd be good to know what you are trying to do on that. The other thing is about the anxiety, stress, depression, the sickness reasons. You know, you've got a really good health and wellbeing strategy, which you talk a lot about in this report. But obviously something's missing, because this is a 3-year trend on the anxiety, stress and depression. Yet you've got the mindfulness classes, relaxation, you've got all these other things going on, how you're helping, but obviously it's not helping this. And I was wondering, is that a key area within your organisation? Is it just not one team only, but is it a certain area that's impacting more? Yeah, and the last one is about staff survey. It would have been good to see the results of more of the staff survey rather than just the one or 2 bits. But yeah.
Okay, so with regard to the turnover, we are looking at are we counting, because we clearly benchmark ourselves against other provider organisations. It hasn't been released to me yet, but I understand the latest analysis, actually we're in the middle in comparison across Kent and Medway. So we're not an outlier and such, but nevertheless, we can't not look at the stats and actually say, what are we doing about it? What we have been doing is we have recruited some additional HR support individually into the clinical teams. So rather than doing an exit interview, which a lot of people don't actually like to do, we're actually having those face-to-face dialogues that says, why are you going? Can we prevent you from going? What is it that we could do differently that will actually retain you? Or what can we learn so it doesn't happen to the next person? Some of those findings that we've found, which we've corrected, is we do have a corporate induction and then we have a local induction. So the local induction is, well, the organisational induction first is a kind of, this is MCH and this is the exec board, etc. And some of the stat and man. But the local induction is a really crucial one because it's about the service that they're working to, making sure they've got a buddy system. So when they're new, irrespective of how experienced they are, is recognising they want that buddy system in place. Since we've done that, we have noticed a reduction in those key areas such as community nursing where it was slightly higher than what we would have liked. So I think what we now need to do is we need to roll that out. We're also looking at competencies, upskilling and looking at a variety of skill mix to say, actually, if we've got a really challenging team and we cannot recruit to those very skilled clinicians, actually, what else can we do differently that takes some of the burden off of the more highly trained, qualified staff and actually bring in a slightly junior mix, but also grow them for succession planning as well. We've got a really good apprenticeship scheme. We've got good numbers, and our retention of the apprenticeship scheme is really, really high. So I think we're on the right track, but we still need to do further. Community nursing is a key driver for those stats, unfortunately, and that is because it's a very pressurised job, and we are really struggling to recruit to community nursing, as is a national picture. So that's what we're doing around the turnover. Take your point about the staff survey. Hindsight's a wonderful thing, but actually I could have actually brought in a lot of positives from some of the comments back from the team. So can certainly, next time I come, can do a bit of focus around that because actually it's quite an in-depth survey. And there'll be some challenges and what we're doing about it, but also some of the positives. I think you had a third item, and I can't remember what
That's
it
all right,
was.
Penny. That's okay. It was about the anxiety, stress and depression.
Oh, yes.
You highlighted that specifically in the report and said it's on a free, this is your third year of that.
Yeah.
So I was wondering, is that just specific to an area within your organisation?
No, we don't.
Or how is it not working with your health strategy? How come it's not helping with that?
Yeah. So community nursing, bless them, will be a high percent because it is a very stressful, given the vacancy factor and not being able to get backfill with agency or 0 hours. And I think staff on the ground, we're encouraging them to be much more open. We have been for the last 4 years around putting their hand up to say that they're stressed, to say that they've got a problem, so we can actually work with them. So in some respects, I'm happier that they're actually reporting it so we can actually have a dialogue with them than them actually ticking another box of why they're sick and then it's hiding the truths. We have done over the last year quite a lot of work with our elected members forum, so our shareholders, and that's targeting the health and wellbeing, looking at different. So we've got a multitude of health and wellbeing schemes, but some services won't uptake on them because they're putting their hands up to say, we're already stressed at work, so I can't take the time out to do the reflexology, I can't take the time out for the massage. What we're saying is that's okay, that's a good thing to do, work with us. So we're looking at different venues, so we think we might have focused on two specific venues, so we want to make it a little bit more user-friendly, so we're trying to look at alternative venues which might be down the road for the staff member. Also the hours, we focused a lot in hours for these, but actually if the staff aren't going to uptake on them, actually we need to look at how we can actually do something out of hours where they might feel a little bit more relaxed and more able to attend. But we also recruited, we haven't recruited, we've asked for existing substantive staff to become champions. So we have a number of champions around health and wellbeing, and our EMF, our elected members forum, we've targeted 2 of those to actually be the really, really skilled champions to work with our health and wellbeing champions, to actually really get the word out, because you can do global messaging, you can do team meetings messaging, but we're clearly not getting out to the hard to reach areas that says it's good to uptake on this, or actually if we're not giving you the right health and wellbeing progress, what is it that you would like? So we're forever canvassing views, very quick snapshots, so it's not an arduous task around what else would you like us to to see. And everybody's saying that they love the programmes. So we're clearly ticking a box for a cohort, but we're clearly missing out on something else. So it's work in progress, and we've got a commitment from board and exec that we'll completely change the programmes and try new things.
One quick follow-on, Chair. Just one quick one. It's just thank you very much for all that, and it's only a quick answer, Penny. But there is a crisis line. There is something for you do advise them staff where to reach out to, even
Absolutely.
at 3 o'clock in the morning, where they can, if they're feeling that
Yes,
depressed
we
or
have
that stressed.
We have a 24/7 counselling line accessible for all staff and indeed their immediate family. And we also have in-house freedom to speak up or mentoring or coaching, or we have our elected members forum where they can have a confidential quiet space where they report back to our board of concerns that have been raised but anonymous. So actually there's the comfort in that for the individuals.
Thank you. Councillor Elizabeth Turpin.
Thank you, Chair, and thank you, Penny, for your report. Just a few sort of comments and questions, some sort of similar perhaps to colleagues tonight, but just on the recruitment, really pleased to sort of see that. I saw it advertised at the time. It seemed to get out there quite well. So, and that's, you know, I think I looked, it equates to sort of 16 full-time posts, I think, and it's good to see some part-time positions in there as well. And I don't know if that was because that's what you requested or that's what sort of the applicants were asking for.
Sorry, it was a combination.
Okay,
we basically did an open recruitment day that says these are the skills, these are the posts that we require. We'll work with you to be adaptable and flexible. So actually, let's not advertise for a full-time post if there's someone out there who wants 24 hours a week, because actually that's really good for us as well as for them.
Yeah, well, that's really great. That's really positive, and I think that really helps with, you know, people's well-being going into the roles and hopefully being there longer term if they can, you know, if they're taking on what fits them. So that's a great positive. Just with regarding the safeguarding position, because you state that you're fully staffed, however, about the named nurse on maternity leave. So is that covered? I'm hoping that's sort of a covered position during that time.
No, it's not covered. We haven't been able to get backfill for that position.
Right, okay. And then finally, yeah, again on the staff survey, just, you know, obviously it's 2/3 that are positive, but, you know, it's a high proportion of staff, 1/3 that are saying that, you know, there isn't positive action, and obviously it's healthcare is what you do, you know, it's a big concern. So it was just sort of, despite the measures that you'll put in place, and I appreciate your sort of answers just now with regards to, is it purely on they're not happy because they feel they're just too stressed to take on, you know, these measures that you're putting in, or were there other things that they're concerned about?
Well, we've tried to canvass views from staff, but we don't get a huge response as to why the uptake isn't happening. As I say, we're open for change. We hold regular different types of forums. So I know in about 3 weeks' time, I've got to ask exec that me and Martin, the managing director, is holding. And it's a free forum for people to turn up or dial in to ask anything or put us on the spot to say, what are you doing about X, Y, or Z? We do a lot around our intranet, around asking spot surveys around, did you like this? What could we change with that? So we're doing a lot of different avenues of how we try to canvass the views. I think I'm going to kick myself now that I probably didn't put more around the staff survey, because I think there is quite a lots more positive, as well as some of the challenges that we still need to address.
Thank you. Councillor Purdy.
Thank you, Chair, and thank you, Penny. And I think we all appreciate what good work MCH do. I know that we're going to be picking out the bad things, but they, on the whole, I think they do a pretty good job, and you always hear good reports back, or at least I do. So, yeah, I'd say well done.
Thank you.
But having said that, I'd like to turn your attention to page 33, 5.3, when I'm a little concerned, in fact, I'm very concerned, to think that we have had errors with medication and somebody falling. Now, to me, they're both serious things. It doesn't say which one was wrong and which one was right, and I don't know and don't want to know. But I think that it is something that has to be looked at, because medication is extremely important. And somebody falling, you've set them back how long? you know, you've done a lot of good work, they fall, and then, as I say, it doesn't say which one was right and it doesn't say which one is wrong, but just to see them there gives me a great concern, Penny.
So in relation to the falls, that was a Darland resident, and I will give absolute assurance any medication error, any potential harm or harm is fully investigated on an individual basis. And we also take any serious incidents very seriously, and we report them on a regular basis to both the CQC as well as to the commissioners, and we send a full detailed report of any lessons that we may have learnt, or was it that actually there was nothing that we could have done, and there's a very, very detailed chronological investigation of those. And we then share any findings from those reports with the wider team, so we can actually, even if they've had no harm or potential harm in their services, they can learn from other services. So we're always working with those. We have a quarterly GAIN meeting, which is gaining assurance. And again, we put services on spotlight at those to again share the experiences of where we've discovered any areas that we could have learnt from, and that we can disseminate that information to the wider organisation.
Thank you, Penny. I'm sure you do. But as I say, that if there is any mistakes made with medication, there should be a very, very strict regime there to see that people check that and make sure there isn't.
There absolutely is, and there will be at times an error, and we will discipline staff where it's required if it's been in unprofessional conduct. We'll also make sure that if there was an error that actually we can learn from, that we then disseminate it.
Okay, thank you. If there are no other members, thank you. Back to you, Councillor Purdy.
Now, this is a nice, simple one for me. I can get my head around with this one, Penny. I move that we note the report and request a further update in 12 months.
Thank you.
Thank you. And can I just thank you, because you started off by saying that you assumed we'd all read your report. Michael writes me nice notes, which I always forget. I'm supposed to have said, please, if you can keep your introduction brief, which you did. So thank you very much.
Top marks, you saved his bacon.
Michael makes us known that what we should do in advance, so.
Thank you. And again, Michael's also, is that, thank you, Elizabeth seconded. And agreed. Agreed. Thank you. Welcome, Andrew. That takes us on to agenda item 7, the Kenton Medway Safeguarding Adults Board Annual Report 21 to 22. Andrew Raby, the independent chair of the board, will introduce the report, but as I've just said, if you could be brief, please.
I'm going to score some points here because I'm going to say I'm assuming everyone's read the report.
Thank you.
And I do assume people have read the report, and I think I'm here really to answer questions. I mean, the annual report is a summary of the work that's been done by all agencies across Kent and Medway. I'm here to talk about Medway. I'm always delighted to be here at Medway. I've been here 3 times to present this report and the strategic plan. So I'm really pleased with the interest that you have in the way of the work of the Safeguarding Board. A couple of very quick points. This report relates to the previous strategic plan. A new strategic plan was launched in November of the last year. So we always seem to run slightly behind in relation to this. And it is, so it is that. So I will leave it for you to ask me questions and hope we can work through from that perspective.
Thank you. Councillor MacDonald.
Thanks, Andrew. You'll be glad to know mine are pretty short, so don't worry. It was a good report, good to read.
Thank you.
There's some good stats in there. My only thing was on the front paper, when you're talking about your workshops and your events, your public events, you listed the number, but didn't sort of give us the feel about how many did in Medway. So you did about the specific cases and instances, but it didn't, when you said about your workshops and your public consultation events and really nice events that you're appearing at to publicise, which is really good, I didn't get to feel what the Medway. You may not have the stats tonight, but it would have been good to have that bit more detail about the Medway specific ones.
Yeah, and I'm sorry that wasn't there. I'm always really keen to ensure that the Medway data is here, and I talk about Medway because I actually come from Medway. This is the thing for me. So I'm really important to me to make sure that you know that. So I will take that away.
Okay.
One of the things we do is a lot of the stuff we do is actually online and is open to attendance. So we do sort of events online where we invite people to attend. We put on speakers and we invite it and we throw it open to everyone. So we have charities, we have organisations, volunteers, counsellors, the lot, and then we put presentations on about safeguarding of things that we've learned through our SARS. But Vicky, who does this report, is always very, very keen to ensure that there's that division. So you'll see with the, because there's two things we always have to put in. We have to put in the SARS, so we have to put in details of the safeguarding adult reviews we've conducted in the previous 12 months. And we have to put in what's actually been done around safeguarding across. So I always pick out the Medway ones. They are there, but I take the point.
I mean, and thank you for that. It'd be good to find out. I mean, when I moved on to the actual report, I was relieved. I was scribbling away. Then all of a sudden it was Medway all the way. So I know you did. The other thing I'm always, which you know I will be, always a little bit dubious of is when you mention voluntary sector and the voluntary agencies, because you list all the other agencies there, but then when you say you work really closely with the voluntary sector in Medway, I tend to want to see some detail about that, because you know the publicising of safeguarding is especially you've got a vibrant voluntary sector in Medway. It is their responsibility as much as it is statutory, and they're the ones that actually will pick up some of those cases for you probably and highlight. So it wasn't clear. I don't want it now, Andrew, but it wasn't clear about what the voluntary sector and how wide that sort of grasp is within the Medway towns.
It's always a very difficult one with the annual report because last year we were told there was too much detail in the report. Not here, I've got to say. So we decided to actually put appendices in to highlight the things that backed up the overview. And, you know, I do take your point. I'm really keen on the voluntary. I'm a volunteer in many aspects myself. I know the importance. I know about the MVA in Medway, and I know how important the contribution of the voluntary sector is to actually safeguarding. So we do try to do a lot. A lot of our focus now with our webinars is around the voluntary sector speaking to practitioners and agencies. It's something we've got to build upon. The voluntary sector are represented. We're going to look for lay members. We've got to actually get the voice of people into what we do. Advocacy people are looking to put together a group for us, as are Health Watch in Kent and Medway. Health Watch are doing some work with us around reviewing and looking at some of the learning from our SARS to see whether in practice that's actually manifested itself in change to people affected. So it's really important. You're absolutely right in what you say, and it's getting that balance right. We'll probably come in next year and you'll say there's too much information.
No. If we're in next year. I think the key thing for me is it was really refreshing that you mentioned the voluntary sector, because those that are around here, no Sue will know, those that are around here, I always bang the drum about the voluntary sector. Yeah. But I will always, so it was good that you mentioned it. So because you mentioned it, I asked the question of who it is. But the key thing is as well, remember, it's much bigger, the voluntary sector, than just the big agencies at the top. There's those small ones at the bottom that are dealing with those hidden communities that you may want to hear the detail from. So it's not to forget those hidden voices. That's all. It's not a criticism, but and I bet you do get lots of information from them. But it's never to forget the voluntary sector is bigger than just a few big ones. It's those.
I'm a trustee. I'm a trustee for a very small charity called Bright Shadow. We support people with dementia, hoping to come to Medway, and it's a very small charity, and we do struggle with that because the big charities now are sort of taken over in terms of actually funding allocation, and the big organisations are far more set up to obtain funding than the small charities. So I will, like you, bang that drum. I think it's really important.
Thank you. Yes, Councillor.
Yeah, I'm looking at 4.2.10 on exploitation, and I wonder if you could say a bit more about what safeguards. Sorry, can you hear me properly?
Yeah.
What safeguards are being built in to address the issue, particularly for vulnerable people
who are in semi-independent living. Could you say a bit more about that?
I absolutely can. It's something that I've been highlighted, and I've worked closely actually with the Medway CSP over this. Exploitation, and I've got to say, and I highlighted this to in the violent crime strategy, the Medway are in a fairly unique position. You have Shared Lives here, which is a very powerful group that actually works really, really well with people with learning disability. Now, we're seeing an increase in exploitation of people with learning disabilities by people who are coming into their lives, manifested themselves as carers, and actually taken over benefits and actually taken over their lives as a result of that. It's a growing concern. It's taken over by some of the gangs, and the gang culture is actually getting into that. So and this is actually unique to Medway, I've got to say, because this hasn't actually taken off in the same way in Kent, but in Medway, with the CSP, we're looking to see if we can do some joint work around that and actually building it into the violent crime strategy, because it is violence, it is attacks on people's lives and liberty, and actually we have to ensure that safeguarding is actually for those people as well, because I think one of the things that's changed slightly is there was always a view that things like county lines and things like was all about drugs, and it was in the early days, and it was about making money through that. But now what we're seeing is actually people's lives being taken over through exploitation, and that's something I think we do need to build on. It's an interesting one because it crosses over between the CSP and adult safeguarding and children's as well. And one of the things I'm keen to do is to start looking sort of holistically across this children's partnership, the CSP and adult safeguarding, to say where are our threats, where are our risks, and actually see if we can do some absolute targeted work around that. And I'm getting some traction with Medway and particularly the CSPs. So watch this space. Hopefully next year we can give you more detail in relation to that.
Just, I wonder as well if in those groups of people that are responsible for the exploitation, whether you've come across any so-called religious groups who are trying to exploit people as well?
No, I haven't.
Okay.
No. Not at all. It's
I don't mean the sort of mainstream religious groups. I mean
nothing that I've seen.
Okay.
No. I'm as an aside, I'm actually a safeguarding advisory for the Diocese of Rochester as well. So, and although that doesn't fall into that category, it's something from a safeguarding perspective that is I am aware of through the work that they do as well. But I've not seen anything like that. No. I don't look at all the data, though. That's the one thing I would say, is that my role is slightly more of a bit of a scrutiny and overview of the delivery. So you may find that some of that detail is obtained or contained in either police reports or Section 42 referrals to the local authority. So I don't get the detail. But what I do see is what we see through safeguarding adult reviews, and what I do see is what we gather from information we do our annual review and gather information from different agencies. But I've not seen that, no. Thank you.
Thank you, and thank you, Councillor Van Dijk. Councillor Murray.
Thank you, Chair, and thank you very much for the report. It was really comprehensive, and I must say I found the case studies useful. Following on, actually, from what Councillor Van Dijk has said, one of the concerns that I have is about people who live in semi-independent and so-called supported living, where some of these organisations offer supported living, get a massive hike in the amount of housing benefit that they receive for their tenants, and actually end up not supplying the support that they say that they're actually going to do. And it can place the council in a very difficult position because these organisations can spring up from anywhere, send people here to a property that they've acquired from another authority, and then our staff don't hear about it until something bad happens. Now, certainly in the Labour Party, there's a very strong move to do some licensing about these schemes, so that should there be a Labour government, that there will be a sort of crackdown on changing that situation. And actually, in discussions, and particularly at sort of some parliamentary inquiry committees, that there's been cross-party support for doing the same thing. But I think it's a problem. Cuckooing and exploitation can be part of it, but sometimes it's just that the people who are living in those circumstances at public expense, where we should be getting better value for all of us as taxpayers and better value for them as people who need care. And you do refer to it in the report about people going missing and so on. But, you know, I've had a few local examples of where that situation can occur. You know, there are some very good organisations and there are some much less good organisations. And I wonder what your view is on trying to make sure that safeguarding reaches into all of those places. Because in my view, it's actually quite difficult to keep track of who is where in those circumstances. That's one point I wanted to make. The other point I wanted to make is that I noticed that the majority of those case studies, and indeed the majority of cases that I have seen, involve many more men than women. And I wonder if you've got a perspective on that, and if Councillor MacDonald's referred, you know, to the involvement of the voluntary sector, if there's anything that you think we could do to help men who are vulnerable avoid putting themselves in unsafe situations, because it seems to me that they're perhaps a bit less likely to be the recipient of vigilance by other people in the community, perhaps because people think men are more capable of looking after themselves than women are, and I think we do have to be mindful of that where vulnerability is concerned.
You raise a lot of operational issues, and my job is actually to point out those issues to the different organisations. And you're absolutely right on both those points. And one of the things I would say, and I was a police officer for 30 years, I finished in 2014, and one of the things I say is that safeguarding isn't just about the local authority, it's about all agencies. And actually an investigation, an arrest, a prosecution of an offender is as much about safeguarding vulnerable people as anything else we do. So the points that you raise in relation to exploitation, I think were raised earlier about exploitation, deserve and need to be investigated fully. And one of the things I've done is there's a new ACC Simon Wilson, who has responsibility now for vulnerability in terms of children and adults. And I've met with him and had this conversation and said, the police, who are one of the statutory partners in relation to the Safeguarding and the Care Act, have the responsibility to step up in relation to these issues. So I absolutely agree with you. It's for me and it's for the board to point these things out in the way that you have very, very well put to me, that these risks are there. They do know. I think that the issue is, with all of these things, it's that prosecution process, it's engaging with the CPS, it's ensuring that we challenge when we see cases that actually aren't investigated. I'll give you an example. I have a view in relation to people with learning disabilities that they are probably the most, as a group, the group that's actually the most disadvantaged in terms of so many aspects. I can tell you reviews I've looked at where they have told doctors and people in authority of offences committed by them, which could be reported to the police through third-party reporting hate crime. They're never reported. They never get investigated. And as a result of that, they don't get that service. It's the same with health checks in relation to GPs. There's a target of 65%. And you know, that is their annual checkup. They're subject to leader reviews because their life expectancy is so low. And I think it's a really important point you raised, that we do need to be more focused around how all agencies are looking to protect and support and target offenders in relation to those vulnerable people. That's the first point. The second part, sorry, just remind me your second point.
It was really about the vigilance of over organisations who house vulnerable people, say that they're supporting them and actually don't, even though they take the money for doing so.
Yeah.
And particularly in some of our Gillingham wards, my colleagues and Councillor Price, you know, you've experienced this, and I've experienced it directly in my ward. You know, there will be a property that is being used by an organisation to house someone who is vulnerable, it isn't necessarily the case that the council even knows that they're there until something goes wrong. And then you discover, you know, that the organisation that's running the property has taken someone from another authority on the promise that they'll be offered all kinds of support, and actually they're not being supported in any way at all.
Yeah.
They can have a crisis, they can be exploited, you know, the whole kind
Absolutely.
of thing blows up in everyone's face. And I think the key to it actually is licensing in a way that isn't happening now, because at least then, you know, we would know where those properties were and have be able to put in some element of control and expectation over the support that's given. And I just wondered, you know, how you have, you know, engaged with that on the safeguarding board. But I expect it's probably the same thing. The safeguarding board is alerted when something bad
Absolutely.
happens, not when...
And Jackie's going to tell you exactly what the local authority do.
Right, thank you.
I mean, you know, and before she speaks, I mean, I've had engagements with Jackie on this, who is always extremely helpful, but, you know, I've got a lot of sympathy for the staff in the sense that they have to respond normally in the context of some sort of crisis, rather than being able to plan surveillance and monitoring of the situation.
Yeah.
Can I, for the cameras, Jackie's the Assistant Director for Adult Social Care. Over to you.
Thank you. And I do agree with you, Councillor Murray. So for supported living isn't registered by the CQC unless they are providing personal care. And we tend to get emails through saying there's concerns about a property, and when we look, it's not a property that we know about. And then we find out that there were 4, 5, 6 people living in those properties that have been placed by the local authorities. One of the things that has been discussed in the same way as it's done in children's services is when a child is placed in Medway by another local authority, is whether that's something that we need to be doing in adults, and that has been looked at so that we are aware, because we only find out, as you say, when there is a safeguarding issue, which is too late. So that's something that's in discussion anyway. And there has been discussion about whether supported living should be registered with the CQC, but at the moment that's not moving forward anywhere. So it's a bit of a stalemate position, but I think it's something that does need to be looked at.
Thank you.
And just the prevalence of men in this
that
situation compared to women?
Yeah, I think that the issue that we're seeing evolve, and it's actually at the back of COVID, is there is an increase in concern in relation to men's mental health. There is a concern in relation to the increase in male suicide, and on a national scale. And I think you're absolutely right to highlight it. We're aware of it from our SAR processes. I meet with Mind, and I know there's some really good work that's done with Mind here at Gillingham Football Club. There's a particular group, and I think that we do need to keep a focus on that. And it's not good. It's not good. It's awful. It's absolutely awful. But it's what is good is that we do have that watching brief as a board. So we do keep that lookout. I do meet with public health in relation to raising these. And it's my job to raise these things and actually highlight them and say, look, I'm concerned about this because, and this is my evidence that tells you why I'm concerned about this. Can you tell me what's actually you're doing around it? And there's a statutory responsibility written into the Care Act that says I can ask, and a statutory responsibility to have a reply. So it happens, and it happens on a formal, it happens on an informal basis, but I am very alive to these issues, and I do meet and we discuss these quite frequently. Thank you.
If on page 84 and 85, it talks about new concerns or new inquiries within Medway. And we do seem to have a large increase, and it does say on one page 20%, and on the others year-on-year increases, but our position within the comparator chart seems to stay the same. So are things increasing at the same level across England generally? And how are you coping with that sort of increase?
I mean, I merely monitor.
Yes.
I merely look at it and actually, as you compare it, to look at the data, and Jackie and Leanne look at that in far more detail than I do. What I saw with that is, and I do see this across a national basis, is we seem to have skipped a year and gone back a year before, and the numbers are actually, and this is actually quite interesting nationally as well, are sort of returning to predate of COVID. But Jackie, Leanne, I don't know whether you can give any more detail than that.
Please, Jackie.
Thank you. Yeah, so nationally it is. So from a comparator point of view, other local authorities are seeing a similar increase, and that's why we're staying at that same sort of level. You know, if you go to the section 2.1, and you can see, you know, it was 965 concerns in 2015-16. It's at 2,053 now, and it's actually increased further this year. Now, some of that is because people were taking the adult safeguarding more seriously in the same way as we do for children's services. People are recognising that, and others are because things are happening in the community more. So obviously we're seeing more people, ambulances going out more. You know, that whole increase is therefore then they're finding people that may not be known to adult social care in any way, shape or form, but there's, you know, there could be hoarding or neglect, so they refer to us. So that we're seeing that increase coming in from other partners, but it is, as I say, from a national point of view, that is happening across the country.
Thank you.
If I could just add to that, I think
Please.
from my perspective, I always look at this and say, is an increase in reporting a good thing or a bad thing? Raising awareness so people know how to report concerns, and we say noticing isn't nosiness, so actually asking and empowering the public to report things will lead to an increase. But what we are keen to know is what happens as a result of those reports. So where are the repeats? How are we actually ensuring that people aren't coming back for a second and third time? And these are the questions and the scrutiny that we need to put on as a board. And I've got to say, from a Medway perspective, Medway are very open and actually are very good at actually providing that information. They're open to scrutiny, and they actually want people to report their concerns to them. So I think that's a pat on the back, if I'm honest.
That's to our officers, the pat on the back. So thank you very much for that. Are there any other members? No, thank you. Councillor Purdy.
Thank you, Chair. And thank you, Andrew, and thank you for your report. It was a long report. I'd like to say I read it from page, but I hope I picked up most of what you're doing. And I think that, yeah, perhaps, I mean, it's very sad to sit here and listen that we have got elderly children, elderly people and young children being exploited. But, you know, you're out there doing your best, and I'm sure you will continue to do. So thank you for coming, and thank you for your report. And I move that we note the annual report and the comments of the health and well-being.
Thank you, Andrew. Thank you. Is that agreed? And seconded, Elizabeth? Yes. Thank you. Right, thank you, members. That takes us on to agenda item 8, reducing hypertension in Medway, the annual report of the Director of Public Health, 2021-22. Is that you, David?
Right, thank you. So, yes, so high blood pressure, hypertension is known as the silent killer. It can lead to heart and circulatory problems, kidney failure, heart failure, problems with sight, vascular dementia, and ultimately premature mortality. It's a really important issue, and it's the focus of the annual public health report of the Director of Public Health for 2021-22. The report demonstrates that hypertension is caused by a variety of different factors, lots of different things that lead to people developing hypertension. And it talks about the three main things that we need to do to reduce the burden of disease due to hypertension. So we need to prevent people from developing hypertension in the first place. We need to find those who have hypertension and who are undiagnosed. And then those who are diagnosed, we need to ensure that they are getting the appropriate treatment. All of these things need to be done through the lens of health inequalities, because we know that outcomes are worse for people who are from more deprived areas and also in certain ethnic groups. This report has been presented to the Health and Wellbeing Board, and the Health and Wellbeing Board's comments have been included in the cover paper. So I'll just finish my introduction there and assume that the full report has been read.
Okay, thank you. Councillor MacDonald.
Thank you, Chair. Thank you, David. I think it's a good report, always a good report. The annual reports, they're always good. And obviously, you know, we do know that hypertension and stuff is a killer, and it does cause us problems. I think I was lucky enough. The good thing you did was you done some of these stalls, you done some of these pop-up stalls, and I scared the life out of me, but I bumped into one in Hempstead, and but I was with two other individuals, and one of them was spotted as having, and it was followed up really quickly by the team as well. But you referred it, so I can say that worked. And actually, it'd be good to carry that on in some way or another. I know funding would be difficult, but it would be good to do that. I think there's a real need to involve employers in this as well, and involve, you know, we've got some large employers and small ones. We've got some employers that doesn't take a lot to get a blood pressure machine or get some you know, appliances to be able to use with their staff, and educate them around. You can get a cheap blood pressure machine quite easily in Boots. And also, I'm going to say it, the need to involve the VCS, and I'll come on to that in a minute, because what I was shocked about, though, Chair, and you know, David, is some of the comments from the Health and Wellbeing Board, and I just wanted to put it on record here. I do not think that, and I know he wasn't saying it, James, but I do not think the Household Support Fund should have to support prescriptions, appliances in the home, etc., etc. I think the Household Support Fund is there for a clear reason for those really struggling. It's doing a good work in Medway, for those struggling with cost of living issues. The health element should be funded anyway, shouldn't it? I mean, people with this massive issue of hypertension, there should be funding available. And if people need them changes within their home, there is other elements to fund that, not the Household Support Fund, because it'd be depleted very quickly. You know, very quickly, and you're getting into that debate that even people with asthma having to pay for their prescriptions, and that's never changed. So that's my only worry about reading that. But the accessibility stuff, again, which I will say, there are, you know, you've got so many venues, so many places that people could walk into to quickly put their arm in a cuff, and you'll be surprised they're quite up for it nowadays. You know, they can put their arm in a cuff, they can quickly get a blood pressure, whether it's their local drop-in coffee morning once a week, whether it's a club, anywhere. You know, they can just do that, and if they get that print out or a quick referral, it just might. Some may not take it up and may not go anywhere, and it might be just because they're a bit stressed that morning. They've just dropped the kids off, whatever. But it's a really good thing to, you know, we should all be looking at. And I'm saying all, I mean in the voluntary sector. There are many different avenues, if you was to engage, that people you could speak to will put these in place. You know, I'm not saying people turn up to church on a Sunday and want a blood pressure check, but if you have got places which have a lot of people coming in, they're the places that quickly come and have a quick check. We just give you, you know, and I think that's definitely the area you should be looking at, not going down the Household Support Fund route. I know it wasn't James's comment; it was a comment made at the Wellbeing Board. But apart from that, I think it was a really good report. So well done for that.
Thank you.
Yeah, just briefly, just to come back on what you've just said. Yeah, absolutely agree that there are plenty of opportunities where where we could look at helping people to have their blood pressure checked. We obviously, within the public health team, have a limited capacity, so it's about spreading that across to others who are able to provide that. Yeah.
Thank you. Councillor Purdy.
It's probably along the lines of Councillor MacDonald, but what concerns me that some people, and elderly people, have machines in their home that they bought donkeys years ago. And I've been into people's houses, oh, I've taken my blood pressure, Wendy, and, you know, it's not right. And you think it never will be on that machine. And, you know, and you can't say that. And, okay, well, no big problem. Perhaps we'll try and get you an appointment to have your blood pressure taken or whatever it is. But that is the thing that concerns me, that we shouldn't be asking people to take their blood pressure unless we know that they have the right equipment to do it. And the more places that we have for people to go in as a drop-in centre, like you say, at the coffee morning or some of these wellbeing groups that we hold or something like that, or even the Knit and Natter Club, a lot of them there. But the machines that are reliable, not that they've had them donkey's years, and they have to remember also that everybody's blood pressure isn't exact. Some people always have a low blood pressure. Other people's blood pressure is a little higher. And if you're taking that yourself, you don't really understand that, do you? Or at least from what my experience with people.
Yep. Yes, absolutely right. Obviously, there's not a lot we can do about machines that people have in their homes from many years ago. We can't sort of do an audit of what's in people's homes. But in terms of sort of variability around blood pressure, I think the key thing is identifying people who may be at high risk of having a blood pressure. So if somebody's taken their blood pressure at home or has a friend visit and they've got a machine, they test their blood pressure and it appears to be high on the machine, then that gives them an alert to maybe have a conversation with their doctor and get it checked formally.
Agree, but sometimes, David, it also frightens them. And then you've got to deal with that. They've taken their blood pressure and it's high. Well, actually, I think it's your machine that's the problem. It's not good. But as I say, we cannot be that. But if we do try to educate people to go out more into the community.
Thank you. Councillor Murray.
Yes, thank you. I mean, reading that full and detailed report, I think, put my blood pressure up initially. But, you know, it is a very real problem. And I think for some of the things that have been said go in part the way towards increasing awareness. But as ever, the people most affected are people who are already suffering all sorts of forms of deprivation and are more likely to die earlier than anybody else. And you have heard me talk lots of times about the level of health inequality in Medway. So I didn't necessarily get from the report what was going to happen to tackle those groups who are in greatest needs. And I was particularly concerned about black and other ethnic minority groups who are mentioned in the report with having a higher genetic prevalence. And speaking actually recently at the Small Business Federation, I was talking to somebody who runs sort of assertiveness programs for black and ethnic minority women, who had got on to this issue, that blood pressure is a problem in the community, and pulled in some expertise for the people that she was working with, and found actually that there's a lack of awareness amongst GPs, for example, and other practitioners, that some blood pressure drugs that are given to people from black and ethnic minority communities are much less effective than they are for other communities because of that genetic prevalence. So there seems to me to be a whole piece of work there concerning inequality, and I wonder what the plans are to try to tackle that.
Yes, you're absolutely right. So, yes, the inequalities around hypertension are extremely important. We have the NHS health checks program that we run within the public health team, and we are constantly looking at the data from that, and we target that in areas where there is greater deprivation and a greater risk. So we're already doing that. We're looking at the data and we're trying to target where we focus the NHS health checks. Around GPs and GP knowledge, we don't have any work underway at the moment on that, but it's something that we can have a look at.
Yeah, you know, just sort of, I mean, not anecdotally, because I had quite a long discussion with this person, but one of the things she was saying was that, you know, people will change their diet and change their habits, but they'll only do that perhaps in the context, for example, of eating food they like and enjoy that is culturally familiar and accessible to them. So, you know, it wouldn't be necessarily that you could say, well, everyone's got to have porridge for breakfast and that will make everything better, if in a particular community that isn't something that anybody would have for breakfast, and there definitely are alternatives. But, you know, her awareness of the extent to which that was completely kind of underrated as a way of, you know, getting people to improve if they've got that particular prevalence. I thought it was interesting, and as I say, there wasn't anything in the report about that, and it merits a second look, I think.
Okay, thank you. Councillor Lammas.
Thank you, Chair. Just a quick comment. With the sort of amount of remote working that Medway officers do, is it not possible to, like, you know, once a week or once a month, remote work from inside Tesco's or Morrison's, and then just take a shift and have a sign up advertising yourselves, and then just do blood pressure checks randomly when people go buy their teas and coffees? Is that a way to sort of get out there in the community? 'Cause I think that would be useful. I know not everyone can work remotely, but no one wants to come into this place or answer their phones on Fridays. So why not tell everyone, right, today you're going to remote work at this Tesco's, and they've agreed and they'll give you free tea and coffee throughout the day. I'm sure they will.
Interesting idea. I'd have to think that through. Okay, yeah, interesting.
Thank you. Councillor Van Dijk.
Yeah, on that one, I've noticed there's a bus outside Asda's. It's been there for several weeks doing blood pressure checks, so that is happening. But I just wanted to pick up on the Councillor Purdy's point about blood pressure monitors, and I don't think blood pressure monitors being old and necessarily not working. I have high blood pressure, and my GP surgery does regular recalibrations of blood pressure monitors. So it doesn't mean they don't work, they just need to be regularly calibrated so that they work properly.
If I could just come back on that, Chair, yeah, you're absolutely right, but it's educating people to know that. And as I say, it can cause them concerns when they're taking their blood pressure, and it's not, yeah, so, yeah.
Okay, thank you both. Councillor Croser.
Thank you, Chair. I've just been, thank you for your report, by the way. I've just been going through a series of tests with the doctor to ascertain whether I've got hypertension or not, and I've been put on a program for taking my blood pressure every day. And I get stressed when I take my blood pressure, and I get stressed when I walk up the stairs and do that sort of thing. So I think taking blood pressures from people in public and that at Tesco's while they're pushing the trolley is a very stressful environment to do that. We have lots of little community groups on the peninsula at Who where people go for coffee, and it's just a chill out. And I think they would be ideal places to put blood pressure monitors in. But I think it's dangerous to put the monitor in there to get people to check their blood pressure. Is there any training around doing something like that? If we was to acquire a blood pressure monitor in each of the little coffee shops, for example, around the peninsula, that it could be effective.
So there's no training that we have at the moment that we could roll out, but it's pretty simple how to use those machines. And I'm sure there'll be videos online on YouTube, etc., that would show you how to use the machines properly. It's much easier using those machines than the old mercury sfigs, where you have to sort of watch the level of the mercury as it goes down and count the pressures at the two different points. So, I mean, it should be fairly easy to find out how to do it correctly.
Yeah, okay. Well, I've been taking my blood pressure for about a week, and it was in the yellow, and then realised that I wasn't sitting in the right position, because if you read the book, you've got to be rested for 5 minutes, and you don't want to have just climbed the stairs or just eaten or just done something, and that tends to lend itself to people sitting around a coffee table having a cup. Even coffee would raise your blood pressure. But I didn't know how to put the cuff on properly, and I think I'm quite switched on about those things. So, yeah, but I think that would be a good scenario that we've got. And are the blood pressure monitors available, or is it just a case of buying one?
So, okay, so we don't have. There's only a limited amount that we can do within the public health team. So we can't sort of provide blood pressure machines for all the groups across Medway. The machines themselves aren't that expensive to buy, so groups can organise for themselves to get the money together to buy a machine that they can then share across quite a large number of people, because you don't need to do it every day for everybody. And it only takes a few minutes to do.
Councillor Murray,
You've got your ward fund. You might be able to use that to buy some monitors, if no one's told you about that.
Yeah, I realised that. I was just seeing if there was any free ones
Yeah.
going. But yeah, no, it would be a good idea. And I know that they're not very expensive, and it would. But it was the training, I think, that was concerning me.
Can I just come in, Chair? At one time, when I worked in a pharmacy, they trained me to take blood pressure, and it's quite a simple thing to do. But I don't know whether pharmacies still do it. But I mean, as we're engaging with pharmacies, that would be another route, wouldn't it?
right, thank you. Can I remind members you're not supposed to talk across the tables? But fine. I think Councillor...
Councillor Turpin's before me, Chair.
All right, yes. I thought you was coming in on this point, but that's fine. No? Okay. Councillor Turpin.
I'm just giving Councillor Lammas a description of what hot blood pressure is, so maybe we can go back to that one. It's not just your pulse.
It's your heart rate, right?
No,
Right,
no,
sorry, but no talking across the table.
Perhaps
And you're not...
David can come back on that later and explain what blood pressure is. Yeah, I agree with sort of colleagues on both sides about it's finding someone's norm, isn't it, their blood pressure? Because there's an argument that, you know, you can bring it down by having a hot shower or a hot bath or something, you know, but it might only come down for a quarter of an hour or something, and then you can be racing around Tesco's and it could be up when the rest of the time it's okay. So, but it's, you know, if someone's constantly living a very busy life and their blood pressure is high because of that, then yeah, I guess it's finding the right reading for the person, isn't it? So, so it's finding the right time to test someone. I wanted to ask about sort of monitoring children, because I noticed in the report that it's blood pressure is increasing amongst children, and what I've found is that there isn't the right equipment for children. You can't just use an adult cuff on a child, or you'll get totally the wrong reading. And my son had hypertension, and it was probably undiagnosed for quite some time, because even though he was going to quite specialist hospitals for children, they couldn't get a reading, so they gave up. And I didn't push it because I thought, he's only 6, he won't have high blood pressure. He did, you know, and it was because of his kidneys. So I'm sort of keen to sort of, you know, if it's increasing amongst children for whatever reasons, that we can have the right equipment to be able to, you know, test them. I took him to the GP. They didn't have a cuff to measure him. They're using, you know, the machines are great, I think, for adults, but they're not always great for children. They wiggle around and stuff. You can't rely on them. It needs someone to actually use the old-fashioned pumping up system. So I'm just keen to see that, you know, within the recommendations, finding those that are undiagnosed, there can be perhaps something looking at how we actually, you know, find children amongst this group. Thank you.
David?
Yes, absolutely. I must confess that hypertension in children is not an area that I'm terribly familiar with. I've done more work with most of my work with adults. But yes, it's something I'll discuss with my colleagues.
Thank you. Councillor MacDonald?
It's only a quick one, Chair. It's just a small caveat, I suppose. Even though I was pushing and saying that lots of coffee mornings, lots of places it'd be really good for them to invest and to get in these machines. The key point is to be able to follow up if your blood pressure is high. So if you have a constant high blood pressure and then you can't get a GP appointment or you can't get advice, that was the key thing with the stalls that you did. My colleague that was found to have a high blood pressure, you had that project where you was passing it straight to their GP and then one of the public health officers rung back. That was really good, quick, you know, efficient service. But if you do get high blood pressure and you can't enter anywhere and all of a sudden we've got loads of them everywhere and everyone's turning up at A&E, that would then cause a pressure. So I suppose it's got to be a thought-through process to make sure that GPs and everyone are aware that there's a big new project about everyone having blood pressure monitors and all of a sudden there's no appointments to be seen.
Thank you. I think, yeah, that's fine. Excuse my voice, everyone. There are no other members. Councillor Purdy?
Is it working now? Shall I repeat myself, David, or did you hear me? Just to say thank you for the report and I move that we note the annual report and the comments of the Health and Wellbeing Board.
Thank you. Is that seconded? Thank you, Councillor Turpin. And is that agreed? Agreed. Thank you. Thank you, David. That takes us on to agenda item 9, the Council Plan Performance Monitoring Report and Strategic Risk Summary, Q3 2022-23. Over to Leanne. Aren't computers good?
Thank you, Chair. You will see the report is quite self-explanatory. Can I ask officers to comment on the reds, please? Thank you.
Sorry. If I do
That's
the adult
okay.
social care ones first and then pass over to David.
Okay,
So
over to you.
there are three that just to sort of mention, although one is amber, I think it's important to talk about it at the moment. So the first one is around the percentage of long-term packages of care that are placements. And we'll see that it's shown as improved by 0.8%, but we are still slightly over target. I just wanted to sort of comment, we've talked about this in the past at HASC, about the number of people that are moving into residential care or long-term nursing care. I mean, we recently did a deep dive, a desktop exercise to look at was there anything behind that and why were we seeing a number of the numbers increasing. And what we've actually identified was that the majority of the placements that we're currently making are for people coming out of Medway Hospital. And that's because of the needs and illness that people are suffering. So what we're doing at the moment is obviously we're working to find those people placements. It's their home. I think that's really important to say, that when we move somebody into residential care, that is their home. But what we do as well is we carry out a review very quickly of the placement to make sure that it is the right place for them to be. Because if people are coming out of hospital, sometimes we know that even though they might be medically fit, there's still some improvement that can be made. What we are seeing actually is a very small number of people that we're able to either step down, say, from nursing care to residential care, and I think we've only ever looked at one that's been able to go home. So it's just some confirmation that our IDT team, the Adult Social Care IDT team, are very careful and make sure that anybody that comes out of hospital is going to the right place. And I know I said it earlier, but we do look at that as somebody's home. So I just wanted to touch on that one. The second is the ASCOF 1C, so the percentage of clients that receive a direct payment. And previously, the numbers have been really positive. We've been over the 30% for a period of time. That has reduced by 4.3%, which is disappointing. But it is due to a specific reason, and that reason is that if a day centre is receiving income over a certain amount, they are now liable to pay VAT, and if somebody is receiving a direct payment, they can't reclaim the VAT. So we're having to move people from a direct payment back onto a commission service. So they're still receiving the right level of care, but just in a different way. And then ASCOF 1G, the proportion of adults with a primary support reason of a learning disability, it continues to remain red as the status, but it's improved by 7% since Q2. And I mentioned last time we were doing a focused piece of work around making sure that we were completing reviews. That's enabled us to ask those questions and make sure that the recording is accurate. And we're also improving the way staff record the accommodation status as well. So we're seeing those improvements there, and that is continuing. And that's the three from me.
Thank you. David?
So we have one red for public health, which is PH13. That's the smoking quit rate. Both smoking quits and NHS health checks both took a big hit during COVID. During COVID, we moved to a virtual delivery for smoking cessation, and that helped a bit. But now that we're out of sort of the COVID lockdowns, people increasingly are wanting to move back to face-to-face interventions. We have found that the NHS health checks, I should also point out that the service delivery, part of the service is delivered by some of our own teams, our smoking cessation officers, but then we also have smoking cessation delivered through GPs and through pharmacies. We've managed to get our rates back up to what they were pre-COVID. We are struggling to get the rates back up to the same levels in the GPs and pharmacies, but we have got the rates back up for NHS health checks. So there's something different about the health checks and smoking cessation and the way it's perceived, I think, within GPs and pharmacies. And that's an area that we're still exploring. Project officers are working with these settings to try to understand these barriers and improve the delivery of smoking cessation in those settings.
Yes, thank you, and thank you for the report and for all the work that everybody does to try to move these indicators in difficult circumstances. I wanted to look at ASCOF 1G because in this municipal term and in the one before, it stayed persistently red, and I wonder what is happening across the council with particular reference to planning to help with this. You know, is there a good relationship with planning, particularly as we've got to produce a local plan, in terms of trying to actually make this kind of accommodation a very firm part of what we want to provide? Because I think without that sort of cross-cutting effort, it puts adult social care in a very difficult position. You know, you can only make judgments about the accommodation if the type of accommodation that is needed is actually there, and very often, you know, having a policy where a particular percentage of new developments is compliant with the needs of this group of people, I think would make a huge difference, and I don't think it's happened to any great extent, certainly not in the last few years. So I stand to be corrected if that's not right. I hope there is some work going on, and if there isn't, there should be. On smoking cessation, that's disappointing, understandable, I suppose, because of the COVID gap. But I'm becoming increasingly concerned about the massive rise in people vaping, particularly young people, because I think actually that is having the reverse effect of what was intended in the first place. It's leading to people going on to smoking. And there is a bit of movement now about trying to crack down on some of these vape materials that are quite clearly aimed at children and younger people. My son is a deputy head in a primary school, and suddenly in year 6, it's become a problem. You know, he's had several occasions where he's had to speak to families about the fact that children as young as 11 are coming into school and they've got vaping equipment. I mean, I think the whole thing is completely out of hand, and I actually think it's having an impact on the extent to which people regard smoking as dangerous. You know, that the dangers of vaping are real. They're not, you know, necessarily tested, but they're real. People are still taking in nicotine in various ways, and I wonder what we think in public health we can do about that to sort of link the two things together, because it isn't the case that if somebody starts vaping when they weren't previously smoking, somehow that is better than not smoking at all. It obviously isn't.
David?
Yep, okay, if I go first, sorry, for the ASCOF 1G. So I think if Sue was sitting on, in front of a microphone, she'd be saying how often she meets the planning team to talk about what needs to happen across Medway, any involvement if we see any developments, and if people are putting forward plans. If I say specifically for residential care, Sue's team will work with them to say the type of care that's needed. I meet with Sunny EE, the AD for Regeneration, and Dio O'Rourke, the AD for Culture and Community, and Mark Brethwick. We've got a group looking at what's needed across Medway. But I think it's just important to reflect back to the conversation earlier on about supported living, because when somebody's in supported living, that's classed as them being in their independent living. And what we are seeing, and it talks about the numbers in the paper, is there's very few people with a primary support reason of learning disability and autism that moves into residential care now. Majority of people go into supported living. So when we come to the planning element of it, that part doesn't generally tend to come through, because a supported living provider can just change the terms and conditions of I can't remember the name, but of the property without having to go through planning. So those sorts of discussions aren't there. But what we are doing, and we are talking with Mark around, is what properties are available already in the community that they know that are coming up for sale, and whether we could use them as supported living accommodation or specific accommodation for people with a learning disability.
Thank you.
Yeah, so regarding vaping, so when vaping was, I guess vaping's gone on a journey, and I think that journey is still continuing. So for a while, it has been a good mechanism for people to step down from smoking cigarettes, which are extremely harmful. And vaping, if you're going to do one or the other, then it's better to use vapes than it is to smoke cigarettes. But it's obviously better not to even vape either. When they are being used to support people to quit smoking. Ideally, they're supposed to be used for a short period of time and then stopped. But I think increasingly we're seeing people just switching from cigarettes to vapes and then continuing to use vapes for long periods of time. There has been concern expressed that children would start using vapes and then use that as an entry to smoking cigarettes. Initially, there was no evidence to suggest that would happen. That evidence is now starting to build up. So as the evidence builds up, then policy tends to change. So I don't know where exactly we are right now. As far as I'm aware, nothing has changed at the moment, but we are keeping an eye on the evidence. And if we see this increasing trend, then it's quite likely the policy will change.
If I can just come back quickly on that, Chair. I mean, I think there's a need for an education programme about vape, you know, to show people that really it's a sort of gateway as much as it's anything else within schools as part of, you know, young people's public health. It's gone on a journey, but the journey has been very rapid, actually, very rapid. When you think about the sort of market, and of course, it's got loads of things that are wrong with it. You know, terrible recycling impacts, apart from all of the health impacts, and a very bad impact, actually. It's an expensive, you know, it's not a cheap alternative to tobacco. Actually, it's quite expensive. So it's having all sorts of undesirable impacts, and I think it merits a really good look, actually.
Thank you. Excuse me. Councillor MacDonald.
Was you laughing because I put my hand up, Jill? It's only two quick ones. From the vaping, just following on from the vaping, I totally agree. And I think there might need to be some work with our licensing team. So, because at one time we had about 5 or 6 vaping shops, for example, in Gillingham High Street. And then they add on the bit of extra nicotine each time. And I think there needs to be some licensing over that. I am going to bang one more drum, though, which I always do again. It isn't a VCS this time, it's a different one. And Leanne or David, you can take it back, especially to James. I know we are an obesity-obsessed council, and I can understand the health implications of worrying about people's weight. But when I read on here again, on 156, about all the good stuff about it's really good, young people's weight has gone down, I just want to throw that caution stuff about eating disorders. You know, we can get all the great things, get greens and say it's wonderful. We've seen all our kids lose weight. We've seen a real reduction in weight, etc. But we all know, I know with the schools I'm involved in, that eating disorders are on the increase. And I know it's not necessarily going to be picked up here, but I just want to throw that back again, that it's something we are going to have to keep an eye on. Because yes, if you reduce the obesity levels, we can really cheer. And I remember at the elections last time. Do you remember we was all told to do this challenge about steps and how many steps we all did, and when we first in 2019, and actually that, well, you may have had councillors there, that would have encouraged some eating disorders of some kind, or encouraging trying to compete and trying to compete and catch up with people. So I just don't want you to miss, not only in young people, but in adults, but young people specifically here, don't miss that in Medway eating disorders is increasing. And I don't want you to forget that in all the good work you're doing, but don't forget that bit.
Thank you for that, Dan. Any other member?
Just a comment, really. I mean, Councillor Murray was talking about vaping and nicotine, but actually, what about pregnant women? I mean, we're always banging on, don't smoke when you're pregnant because what harm that does. But some of them now vape, and that can be a huge problem. And we never seem... Just to give you a little bit more blood pressure.
Yes, right. Yeah, right. Right. Back to you, Councillor Purdy.
Thank you, Chair. Yes, got me thing on in case I can't move it. I move that we note the Q3 2022-23 performance against the measures used to monitor...
Councillor Purdy, sorry.
I'm only reading what you've written down here.
It's the next report. It's this one.
Oh, sorry, I've moved to... It's not that I'm in a hurry to finish the meeting. I move that we note the annual report and comments of the Health and Wellbeing Board. No, that's not the right one.
No, that's the last one.
That's the one I was reading.
That was a blood pressure one.
Oh, no, sorry, you were correct. Sorry.
I know it's my last meeting, and I'm quite happy to be made a fool, because I've been made a fool for the last 20-odd years. But don't overdo it.
Pause anyway. Emma Sue, would you like to come in?
Yeah, it was just a quick one for some clarification on PH 13 about the smoking cessation. There's a comment there about 501 quit attempts providing a 59% success rate. As far as I know, and any statistics I've followed, that appears to be extremely high. So I just wondered if that was because of a particular service or pathway that these people were using, or whether if somebody moves on to vaping, is that considered a quit?
Yes, so switching onto vaping is considered a quit currently, yes. But that's not just a local Medway approach, it is a national approach.
Right, thank you. And again, just for the cameras, Emma Sue Willows is the representative from Health Watch. So, thank you. Councillor Purdy.
Right. Now, I hope I've got this right, Michael, all right? Because this is what you've written, all right?
You are right.
I move that we note the Q3 2022-23 performance against the measures used to monitor the progress against the Council's priorities and note the amended risk summary.
Thank you. Is that seconded? Yes, Councillor Turpin. And is that agreed? Yes, agreed. Thank you. And thank you, Leanne, for presenting. That takes us on to agenda item 10, the People Directorate Risk Register Summary. Leanne.
Thank you, Chair. I'll take this as read. I do want to draw your attention to DR 13, the readiness for CQC assurance review. Chair, can I suggest that the Assistant Director for Adult Social Care provides a briefing note on this? The interim guidance has been released, and I think it would be useful if committee received a briefing note in due course. It is very important. It's important for quality. It's important for a whole range of things. But you'll see there the reputational damage for council is something we need to consider. The review itself will be published, will be a open to the public document. So we must get this right for a whole lot of reasons. So if Jackie can provide a briefing note, that would be good. The other one is DR12. The safeguarding backlog of inquiries still exercises me. The team have done a good job to mitigate that, but until we can move to right size that service, things will not improve as we would wish. But Jackie and I will be driving that, Chair, just to offer some reassurance on that point. Thank you.
Yeah, I mean, really, just to support what you've said and to ask the question, you know, is there a compelling resource need to make sure that staff are well positioned to meet what the likely demands are? We've seen that in children's services, that was not the case. And I wouldn't like to put all of the hard work and effort that people do in jeopardy because people have to be diverted into this without the need for additional resource and education. I know that you're doing a lot with the staff to help them to understand it. It's welcome that there's going to be a briefing note for members, but I think there's a huge amount of uncertainty, isn't there, hanging over the Directorate at the moment. You know, we haven't got clear indication of exactly how much the Better Care Fund is going to be still. Beyond the budget now, we are, and that clarification isn't there. And we don't know about the public health budget either, which is a very odd situation to be in. So I think I would like, Chair, for that to be recorded from us as a priority for the Cabinet, you know, to make sure that the Director, if it finds support with other people, and if it doesn't, just from us on the Labour group, you know, the Cabinet do ensure that they provide you with the resources you need to meet the new demands of the CQC. Because if we end up in a situation, you know, notwithstanding it's a bit different for various reasons, but the reputational issue is there, and that can have all kinds of ramifications for the partners that we work with if things didn't go well. I want to be assured that there's prioritisation. And the other thing I would ask Leanne, you know, do you think there is good oversight by the Cabinet of the standards that the CQC expect? I mean, one of the things that happened when children's services went into inadequate was that it was quite clear that the monitoring that was happening, so dashboard monitoring, ended up in a situation where people were pursuant of trying to get everything green and not looking underneath the reasons why they, you know, various elements might be amber or red in the first place. So, I mean, are you confident that there are things in place to stop that happening again for adult social care?
Thank you for the question. It's resourcing around improvement work is certainly something you need, and I think Medway Council learnt that with its children's. Jackie and I have worked quite hard and have secured improvement funding. Whether that's enough, how long is a piece of string really, because the interim guidance has come out today. So we're flying a little bit, Councillor, to be quite frank. However, I do feel that we have a better grip on what the performance information, what's necessary, how that's presented to scrutiny, how that's presented to Cabinet, I am assured. But whether it's enough, we can only get those benchmarks as the CQC process starts out. Because I think, to be fair, it's a learning curve for all of us, but to assure you, yes, there is a sum of money identified for improvement work.
Thank you. And Councillor Price.
Yes, thank you for the report. I just wanted to commend, just in case members hadn't read the Appendix B, pages 199 to 203, with the case example of Jack as a young carer and the work which Carers First Medway did with him, which was able to really support his position as a carer for his father, who he wasn't living with, but providing a lot of emotional support, to the extent that he was supported with a laptop to aid his studies, and also supported to the extent that he became a peer group leader with other young carers. And it just goes to show that it's not always about resources, but it's about targeting those resources. And if the small amount we get from the Better Care Fund can be targeted in that way, it can produce much more benefit than the actual amount of money that you'd have thought about it in the first place. So I'd like to commend people who've been involved with that, and I'd like to think that that's not just a rosy example, but that's happening further with other, particularly younger carers who have got a really big challenge, because they're just starting out in life, but they're also involved with caring, which is a very noble thing to be involved in. Thank you.
Councillor Turpin.
Thank you, Chair. I just wanted to ask a question with regards to DR14 and the recommissioning of Children's Nursing Service. And there's very high risks there. And I just wanted to ask about the actual, what the process will be with regards to what will be recommissioned. I know it's been highlighted in this on this committee before that there's real differences between adult community nursing and children in what's provided. So I think the adult service is a 24/7 or out of hours service, and the children isn't. And is that something that's going to be looked at as part of this process?
Okay, so I must confess I'm not familiar with the detail of this recommissioning. It's handled by Ailish Geldenhuis. I'll ask Ailish to get back to you on that one. The key risk here is that we're dealing with is around the legal issues around recommissioning the contract.
Yeah, I appreciate. Sorry, I'm sort of straying out slightly of what's in here, but as I've seen that, I just thought it perhaps needed asking, because it is quite a concern. We're relying on, the hospital, obviously, to, children's ward for children with quite complex and serious life-limiting conditions to have to use the hospital, whereas it's different for adults, and I'm just wondering if it can be, as part of this, it can be evened out.
I'll take that back to Ailish.
Thank you.
Thank you. There are no other members. Councillor Purdy.
Thank you, Jackie, and thank you for Leanne, because I think it was a pretty good report, and highlights lots of problems, but there you are. I'm sure you'll get over them eventually. You both do. You both work well. I move that we note the People's Directory risk summary, and Jackie will provide members with a briefing note for future.
Okay. Is that seconded? Councillor Turpin, is that agreed? Agreed. Thank you. That takes us on to agenda item 11. Sue, you've already took yourself forward. The Better Care Fund 22 to 23. Over to you to introduce. Thank you.
Thank you, Chair. Thank you, Committee. Nice to see you all. I'm assuming everyone's read the paper, so I'm happy to take questions, and I thank Councillor Price for his comments on one of the services that's funded from the Better Care Fund, which is the Carers First service, in which the young carers are handled. So, yes, so I've come to committee tonight because the plan in front of you is approved, it is current and it is ongoing. But the window of opportunity for us to go through the governance of the council and the ICB in a time frame when we get guidance from NHSE and the department is fraught with barriers. It's normally about 4 weeks to get this plan in place, and to go through all stakeholders and all governance is impossible. But I thought this year we'd try a new approach, which was to use the current plan, which will be a very good draft of the new plan, for your approval and considerations and comments and additions, because it is very much welcomed.
Okay, thank you. Councillor Murray.
Sorry. Yep. Okay. Thank you. Yeah, I'm particularly interested in the plans that you've got for intermediate care and reablement as a way of, when people come out of hospital, preventing them from going back in again quickly, and also promoting independence. And I wonder if you could tell us just a little bit more about that, and what you think might be necessary to really push that as a service that we routinely offer, rather than, as now, something that's developed because of the need to get people out of hospital quickly, you know, because of different issues further down the track. Because I think it really is a way to give people confidence about staying in their own home if they can rely on that support, and if they have that period of time where they can perhaps even be in a different place that's not hospital, learning how to, you know, get back to a situation where they can manage on their own.
Thank you, Chair. Thank you, Councillor. My ambitions are big. I have big ambitions for the Intermediate Care and Reablement Service, of which I can't say too much about ongoing because it's currently out for tender. But our specification is capturing the lessons learned of COVID and past experience of the current contract, and it has the capacity to be flexed and changed as we go through in this particular contract. So we know when the surges are coming and what the change, if we have something completely different. I think that's one lesson we've all learnt from COVID, is not to be complacent, so the service is going to be very flexible to enable to meet any needs and challenges that the service has. Within that, it's to be reminded that intermediate care is only one aspect of the discharging from the hospital, and that we are looking to the whole of discharging is constantly how we bring people out of hospital along the right pathway is the way we challenge. Oh, sorry, I'm not saying this at all well. It might be a bit late for me. It is to look at it as a piece of the jigsaw puzzle, and we have the additions of step-down beds to be looking at, so that people aren't just going through the intermediate care pathway just because it's there, but because it's got the right service that it has. So we're looking at all the jigsaw puzzles, but to make sure that the intermediate care and reablement service can flex so that it's not just bedded, but that people can be in their own homes and have as much care wrapped around them with voluntary sector support, etc. Because we do link with the wellbeing navigation service as well as the community nurses. All of those pieces are linked in when we wrap care and reablement around a person in their own home. Did I answer your question?
Thank you. If I can just come back to you, I'm really pleased to hear about that level of ambition. And I think, you know, one of the things that's easy to forget is that there are different patient groups who can take advantage of the service, aren't there? It isn't necessarily just older people. You know, that there are people perhaps who might be unlucky enough to have meningitis or an early onset stroke, whose reablement needs are different. You know, they don't just want to be at home. Actually, some of those people in very complex situations want to restart their lives and even to be able to go back to work. So I think it's a bigger and more complex area than it necessarily seems, and that kind of ambitious approach to commissioning to meet all needs, as you say, from being discharged from hospital. Because I think that group of people actually are among those most likely to stay in hospital because there isn't enough provision for those sort of complex needs as things stand at the moment in the intermediate bit. The other thing I just wanted to say as well was about supporting unpaid carers. That there's an unfortunate thing happening at the moment, isn't there, where there's a kind of rush of, what about all these people who are in their 50s and 60s who are not working? It's better, we're going to get them back to work and everything will be all right. And I can, understand that people came out of the employment market in different ways for different reasons during COVID, and that there may be people in that age group who want to return to employment. But very often, the reason that people have, downsized their job or come out of employment altogether is because they've got some kind of unpaid caring role. And I think that's, I don't know if you agree, but I think that's slipped a bit. The right of carers to have an assessment in their own right, meeting their needs, if their needs are employment needs and if that suits them. But what I don't want to see is a situation where people find themselves under pressure to go back to work when actually, that decision is not made lightly by anybody who makes it, is it? To give up your job and your career. And I'm very conscious that it applies to women a lot more than it applies to men. That decision is made very carefully, painfully, consciously often, because there isn't deemed, isn't felt that there's an alternative or a support mechanism for those people. So, I wonder if you think there's more that we could be doing with the Better Care Fund to secure the position of that group of people and make sure that when they make a decision, it's actually the right decision for them as much as it's the right decision for the people that they're looking after.
Thank you. Several things there. Firstly, much to the bane of probably Jackie and James, my line manager, I thrust myself very much into the discharging work purely so that I understand how it works, so that I can make sure that we have the right services. And that goes very much so for those other support services which my service commissions, which is like the well-being, navigation service, the voluntary sector lots, Health Watch especially, and the Carers First. Now, the Carers First is the service that covers that carers assessment, and I read those KPIs, and those KPIs don't ever show that those assessments are in that negative fashion. They support, and they have even reached out to help social care do their assessments if that's, and that's a discussion that's ongoing as well. They've got a very high uptake of assessments, and those assessments are seen right through to referring people to services that they require. So no, I haven't seen any evidence of that negativity, and I would like to know if there is any that councillors come across that they put it past my desk so that I can have a look. Thank you.
Thank you. So, Jackie.
So is very welcome with the work that she does to support us. I'm just going to say that now. She does an amazing job. I think one of the things, if we're talking about this in an honest and open way and around scrutiny, particularly with the CQC assurance review, one of the themes of the review is specifically around carers and how they're supported. Sue's quite right about Carers First and the work that they do. I think that there's work that we need to do in adult social care where I see a social worker will go out to do an assessment for the cared for, but doesn't automatically routinely think about doing a carer's assessment for the carer. So we're looking at that internally at the moment, and if you're going out and you know that there's a carer, expand your time slot so that you can do the assessments at the same time. So we're trying to do a bit of a shift. But because of the numbers and the need, we're also talking with Sue and Carers First about whether actually we could commission them to do the actual carers assessment under the Care Act. So we're looking at different options at the moment, but it is something that we need to get better on.
That's good.
Thank you. Councillor MacDonald.
Thank you, Sue. I've only got a couple actually. So I just want to talk about the discharge because, I know you says there's challenges, but I was lucky enough to be up the hospital, lucky enough to see the smart service, lucky enough to to look up at the big screens and see how quick things are moving now, and there is significant progress. I mean, you can feel it and see it. Although there's still beds left at which they would love to get out and love to move out into the community, you can see the benefit of the services well-being, the discharge, all them services are making some great impact. The main thing I want to talk about is the inequality aspect, and I know that you and the teams in all the different areas have tried to. You are very good at data. The issue is the people you work with are not very good at data. And we have there is an issue, I say we, I'll be careful, there is an issue with that sharing of data. So, you know, there was always an aspiration. I remember you said before, there's always that aspiration. I remember Scott said it as well in the past. There was always an aspiration of having that one story, and that story follows through to agencies and making sure they get, that one person, one voice, a connected service. Where it falls down, it was never falling down at the funding element. It was down to the partners not sharing data effectively. Is there plans? I know you talk about, because the only way you're going to address inequality is trying to reach all those organisations, including small ones that are dealing with those, like I said earlier, those hidden communities. And if you're not getting the data because they're not funded by you, they're not reaching into services that are funded, how are you going to get out there more? How are you going to get that data unless we all tie up more effectively? I know it's not an answer for tonight, but that's how you're really going to. Yeah, you thought I only had one question, but it's a killer one. But the thing is, I know it is a real passion and your teams do. Like I will say, your teams do some great stuff at collecting data. But to reach the inequality areas, it's going to have to really be. You're going to have to really put some thought in and do something out of the box, aren't you, to do that? So I wonder if you've got any ideas of whether you are bringing back that one story, so one person goes to one agency and the story doesn't have to be across everywhere, or you've given up that bit and we're trying different ways of reaching our communities.
Thank you. So from a discharge point of view, that is improving. They've introduced something called the PTL. So within the hospital itself, the departments actually can talk to one another electronically now, which I know it sounds like, sorry, is that new? Yes, it is new. That is something and that has made a huge difference because that's sped up the internal flow of a person. Coming out of that, although we still hit the wall of organisational GDPR issues, there has a data sharing on an informal way. So, we'll ask for bits of information that are just enough a bit of the information to carry that story on. So it does still happen and it does inform services design. And we also ask those different elements of the organisations to come to meetings so that data is shared in an open way that way. So we've gone round the circle sometimes while we're still working on that data laking and all of that. But COVID had a big impact on lots of those elements of the services that got, pushed back and forgotten about a bit while we focused on the element. And that is gradually being picked up. And there is a big push at the moment to digitalise social care. There's lots of money coming through from NHSE, and that's a big topic that our social care and commissioning are working on now. And that will help make sure that our care providers have a electronic care record, not their own, they'll have their own, they can choose their own provider, etc. But that will make a big difference in doing that story sharing. And then the other element from the sharing of data from social care services around the country, that was part of the reforms that was put on hold when we had a couple of changes of Prime Ministers, and that's one element of the reforms that's just stood still for a little bit. Okay, does that answer your question, Councillor? I'm confident, I'm definitely confident that if I want some information, we'll find a way of getting it, but yeah, thank you.
Okay, I have maybe a comment more than a question, but in my view, the CCG did Medway very few favours, moving services out of Medway, and now this is a pooled budget with the ICB. Now, I know the whole idea of pooled budget is that you work together, but can we be assured that the ICB will do it for for the betterment of Medway rather than my belief they didn't in the past. And excuse me, my voice is going.
I can answer that quite confidently. A big portion of the budget from the BCF goes to funding partnership commissioning teams. So we are employed by Medway Council, but our funding is from the BCF, so we're part ICB as well. That is to do that integration between health and adult social care. So everything I do for health and social care.
Okay, thank you. I'm partially reassured. Thank you.
You're welcome.
Sorry, Jackie or...
So can I just comment as well? So we also have a joint commissioning management group that's chaired by Leanne or James or a colleague from the ICB. And because the Better Care Fund is specifically Medway related, any decisions that are made about the spend come through the joint commissioning management group, where there's a group of us that make the decisions about that. So if the ICB are asking for something that perhaps we don't think is appropriate and right to be spent from the BCF, then we would decline, and vice versa. So the spend is really well controlled.
Thank you. David? Oh, Mr. Reynolds.
It's largely what Jackie just said, but just to say that the funding for the Better Care Fund is actually kind of on a Medway footprint, so it's on a kind of health and wellbeing footprint. So we get our own allocation, and that's what we kind of work with the ICB about kind of spending. So it is very Medway focused, like I say, the commissioning colleagues, the social care colleagues, finance colleagues, all work together to kind of control it, both from the local authority side and also from the ICB side. So,
Thank you. There are no other members, so Councillor Purdy.
Okay. Right. First, thank you, Sue, for the report and some of the good things that you're trying to do. And I wish you luck with them, because we desperately need them, don't we, in Medway? I move that we note the Better Care Fund plan for 2022-23 and recommend that the committee's comments be included in the development of the 2023-25 plan. Is that okay, Michael?
Right. Thank you. So is that seconded? Thank you. Councillor Turpin. Is that agreed? Agreed. Thank you. Thanks again, Sue. That takes us on to agenda item 12, the members item, GP Access Task Group. Councillor Murray, to introduce your report.
Yep, thank you. I hope this is self-explanatory to people. It's, if you like, an end-of-term attempt to use, as is our right, a procedural tool to make sure that this excellent report gets to Cabinet and starts on its journey for recommendations. The committee will know that the Labour group reject the idea that the report was insufficient. I don't want to repeat all of the arguments. Suffice to say that we were guided by high-quality professionals from within our own council and from the ICB. Accepting that we weren't able to see as many GPs as we wanted to, we saw key practitioners who could show us good practice and a whole load of allied professionals who had some excellent and innovative ideas given to us with enthusiasm, with time and with commitment. I've shown this report to lots and lots of people, actually. I've taken it to 2 conferences. I've sent it to various Labour MPs, to Swale Borough Council. All of the people that have engaged with it have thought that it was an excellent piece of work. And as the committee will know, we were very disappointed to hear the objections to sending it on its way. With any task group report, there's always something that you could have done differently, better, more of. And as far as the Labour group are concerned, what better time to think about how things can improve when in a crisis? In a crisis, people are absolutely across all the things that they know need to happen to improve their situation. And we heard about lots of them. And as I say, they were given with professional aplomb, with expertise, with enthusiasm and with commitment to making them happen. And the 14 recommendations, including the one about sending it to the government, who, by the way, have not come forward with anything better that I've seen than is contained in this document to improve the situation. So the members of the committee, as you can see, at 2.1 and 2.2 are the members of the Labour group. We're calling for the committee, we're indicating our support for a minority report to be submitted to the next meeting of the Cabinet. Then, obviously, the Cabinet can do what they want to do. I've checked this with the monitoring officer. I'm very aware that there's only one opportunity to send a minority report, but I'm also conscious that no forward planning has been possible about how we might extend the report or do more work on it. We've no idea who is going to be in charge of the council as things stand after the election. We know that the officers who are involved have got all sorts of other things that are taking their time and capacity, and it seems to me that we're at a point where we should be sending these recommendations to people who can actually act on them, share them, think about them, and make them happen in their own communities. And as we heard from Sukh Singh, the key professional on the ICB, when he was helping us and gave generously of his time, even he, who has, got a plan in place for the ICB, felt that the level of engagement had been good, that it influenced his way of thinking about how to engage people in improvements in the future. And he even did some matching work in terms of the way that the interim recommendations that we tried to gather on the way along and the final recommendations could be incorporated in the plans that the ICB have. So I hope members will understand why we have done this. It's something that we are permitted to do, and it would be nice if everybody could support it. But if they don't, the Labour group have got enough support to send this minority report on. Thank you.
My understanding is that a minority report is your right. We've discussed all the points raised before. It doesn't seem a fitting place to go through all the arguments again when you're simply using your right to send a minority report. So with that, I think I'll go to Councillor Purdy for the, to note, as in...
no, Chair, I wish to speak. I indicated multiple times.
I'm sorry, I'm not taking any speakers.
You're denying my right to speak, Chair, as an elected member on this Scrutiny Committee. After I've not asked a question in any item, I indicated at the start of the meeting I wanted to speak on this item, and you're denying my right, Chair. Is that correct?
The right of a minority report is, in my view, a democratic right. Labour have used that right, so...
3.3, Chair, says, this is the monitoring officer's comments, that before monitoring report can be submitted, members are inclined to support such report should be specified that it is reasonable to conclude that the work of the task group has concluded. It has not concluded, Chair.
Thank you. Councillor Purdy, would you read the recommendations?
I'm sorry, but on a point of order, could I just seek advice? What is the point of me being here if I'm not allowed to speak on an item I wish to speak on?
Well, my view is that it's a democratic right to have...
I'm seeking the advice of officers, Chair. With respect, I'm seeking the advice of officers. I have your view already.
Michael.
Yeah, I mean, essentially, it's up to the chairman to decide how to run the proceedings of the committee.
Right, in that case,
thank you.
In that case, then, I'll write all my proposals that I have very great notes for to the chairman to the CEO of the council and the incoming CEO of the council. This is frankly a laughable report. It's a waste of my time being here.
Councillor Purdy, will you please read the recommendations?
Can I have a point of order as well, please? I mean, I think I agree. It's pointless bringing this report here if we're not allowed to discuss it at all. Otherwise, it should have just gone straight to the minority report. Just go straight to cabinet. It doesn't have to come here.
No, it didn't have to come here.
If it's come here, then it needs to be
But
it needs to be an actual item.
it's a minority report, so it will be sent. So it's pointless going back over the old arguments. Thank you. Councillor Purdy.
I move that we note that at least 3 members of the committee have indicated their support for a minority view to the GP Access Task Group interim report and interim recommendations as set out in Appendix 1. We will be submitting for consideration by the Cabinet at the next meeting on the 4th of April 2023. I note that if a minority report is submitted now, no further minority report can be submitted at a later date.
Thank you. Is that seconded?
Yes, seconded by me. Yeah, thank you.
And is that agreed? Right, thank you. So, thank you, Michael.
Just on the work programme, members haven't got anything to add. I think the report is fairly self-explanatory, but happy to take any questions.
Is it in the circumstances, Mr. Chairman, is it possible to have a recorded vote? It's gone. Okay.
Presumably you mean on the previous item, on the yeah. Too late now.
Sorry, if I can explain. The Labour Party have, or any minority party has a right for a minority report. So we can discuss it endlessly as we have on different occasions, but the minority report will go forward. So it seemed pointless to carry on. And I'm ending it there.
But it might have more than minority backing, mightn't it, here? So would that carry weight for it when it goes? Because obviously last time it was voted on.
I'm sure if you wanted to add your name, it would be welcomed. Right, thank you.
Through you, Chair, absolutely. You did last time.
Right.
And,
thank you. We have moved on. So I would like to end by thanking everybody and bringing the meeting to a close. Sorry. Right, other recommendations on the work programme agreed? Agreed, thank you. Before we leave, I would like to thank all members for their contributions over the last 4 years, in particular those members who are not standing at the local elections in May and for whom this will be their last meeting. And, and for members that I work with on other committees, as in Councillor Johnson, on the Corporate Parenting Board, I'd also send him my best wishes. And Leanne, you wanted to come in?
Yes, thank you, Chair. I just, on the back of what you've said, on behalf of officers, would like to thank members. We're at the end of the electoral cycle, and it's been a pleasure for officers to support you and your efforts as you serve the adults of Medway. So I just wanted to give my weight to what you've said, Chair. Thank you.
Thank you. Councillor MacDonald.
Yeah, Chair, I just wanted to add as well, politics aside, we have worked on focus groups and together, and we've done some really good focus groups over the years. I won't let Sylvia and Councillor kill me, but I will just pay a bit of a tribute to Wendy as the Vice Chair, because we have disagreed sometimes, but actually, as Councillor Murray would agree, we have fought some battles in here, which you have been supporting. We have won closures for certain closures of places, and you've been. So I did want to pay tribute to all of those that are going, but obviously working on this since 2015 with you, Wendy, just pay tribute to you, and you have put a lot of work into this committee. So I wanted to pay, and obviously others that may not be here next year, you never know, but including us. But I just wanted to make sure that you knew that that we appreciate, especially the social isolation task group, which was a real success, and we shouldn't forget that going forward.
Can I just come in, Chair? Thank you. I'd like to thank you, Dan, because I think we have across the board, and I'm a little sad that my last meeting has ended on such a low note, because I've always enjoyed this committee, and I've enjoyed working with David. And I just wanted to say, yeah, we have worked together because we've always thought that people are more important than politics. And I hope that continues at the next council, whoever's in charge, with the same, yeah, but we've laughed, we've smiled, we've cried, but we've got through it. So, yeah, thank you, and thank you for your support, and for Councillor Murray, everybody, because I think we have worked very well as a team. And most of all, I'd like to thank Leanne and all the staff for everything they've done. I think Jackie's done an outstanding job, I really do. I was so impressed with how you handled the closure of Berringrave and got all those people sorted. And to carry on, we're now going to have that as a nursing home. It is going to be a nursing home again. So I think and it's going to be a very nice one, I'm told. We have spoken with the owners and it seems as though that's going to be moving forward. But thank you, and thank you for your support, Leanne. Everybody's, because whenever I've got on the phone with all my moans and groans, someone's always come back. So thank you.
Yep, just quickly, Chair, from me, echoing everything Councillor MacDonald said, and indeed what Councillor Purdy said, you know, one of the things about this committee is that we have had to work together because we've got the joint scrutiny with Kent, and we've had task groups that have been very faithfully centred on getting things better for people in Medway, and I think we've done that well, and we've had actually some really critical battles in terms of the way that we want to have services for people in Medway. I think about the stroke services where we had absolute unanimity and we gave it our all right through the judicial review process, and we supported each other in that, difficult though it was, and with an outcome that I still don't believe was the right one. And we have, I think, experienced some serious losses. Another big battle that we had, again, with absolute unanimity, was the work that we did on trying to save mental health inpatient beds. We were absolutely right. We still need more of them. The situation hasn't improved. So notwithstanding our political differences, and they are many, and I would never say they're not important, I think in the context of scrutiny, we have worked well together. I do thank my Labour team, who have been, you know, very solid and supportive and good-humoured always. And I absolutely thank the staff, particularly you, Michael, who I think, you are. I know you've not been our only scrutiny clerk, but since you've been, you have got a very good-humoured and even-handed way of working that I appreciate. And I think a final word to say about Jackie. When you were appointed, you'd already done lots of things in the council, but I think this appointment really suits you actually, and it brought together a bag of skills that you'd picked up in lots of different directorates, and you've had a pretty laser focus on adult social care, which is important because it doesn't always get, it touches the lives of every family actually, and never gets the public focus that it deserves. So, and to all the people in public health as well, a good partnership with adult social care, and much, much more to do in the future. It's a shame that James isn't here to hear all of this, but I'm sure he's watching. I'm sure you're watching, James.
I'm sure Councillor Lammas agrees with everything we've just said.
I'm sure.
Yeah, and James still wins the prize for the moodiest picture on the front of the report. Yeah. Okay, thank you.
I would certainly agree with the comment that officers need to have good humour dealing with members. So, thank you.